Hi everyone! In this video, we will talk about bloodstream infection that caused by Group B Streptococcus. First of all, what is bloodstream infection? Bloodstream infection, or also known as septicemia, is a serious infection that are caused by the presence of bacterial or fungal microorganism in the bloodstream that called as bacteremia. Strictly speaking, bacteremia refers to the presence of the bacteria in the bloodstream, while septicemia is a serious bloodstream infection that is also known as blood poisoning. If it left untreated, a bloodstream infection can lead to a serious complication such as sepsis, which caused by a strong immune response to the infection. However, septicemia and sepsis aren't the same. Sepsis is a serious complication of septicemia that causes inflammation through the body. This inflammation can cause blood clots and block oxygen from reaching the vital organ, resulting in organ failure. Now, let me talk about the causes of septicemia. Septicemia is caused by an infection in another part of our body. For example, urinary tract infection, lung infection such as pneumonia, kidney infection, and infection in the abdominal area. The bacteria that can cause septicemia is Group B Streptococcus or GBS. Specifically, Streptococcus agalacticae is a species of bacteria that can cause septicemia. It is a normal flora that live in the intestines, rectum, and vagina. Like many bacteria, GBS may be passed from one person to another through skin-to-skin contact.
Let's talk about the sign and symptom. A patient with septicemia might have one or more of the following sign or symptom, such as high heart rate or low blood pressure, confusion or disorientation, extreme pain or discomfort, fever, shivering or feeling cold, shortness of breath, clammy or sweaty skin. As septicemia gets worse, it will cause more problems throughout our body. This may include kidney failure, gangrene on finger and toes which will lead to amputation, organs damage such as lung, brain or heart, and also higher risk for infections over time.
Now we are going to look at case which is the postpartum invasive Group B Streptococcus with fatal outcome. A 46-year-old woman was presented to the hospital with no sign of life after being found unconscious at home. She had recently given birth to a third child with no complication. She had 2 previous pregnancies with uneventful spontaneous vaginal deliveries at term. She also does not have any significant medical illness. During the third pregnancy, gestational diabetes mellitus was detected and controlled with dietary modification. She had onset of labor at 39 weeks of gestation. There was no leaking liquor or any fever prior to labor or during intrapartum period. She delivered a healthy baby and was discharged home the next day. Since discharge, she reported experiencing abnormal lochia. The lochia is described as heavy in amount, blood red color, and non-foul smelling. Throughout the postpartum period, she had symptoms like intermittent fever, lethargy, and poor appetite. She also developed breathing difficulty one day before her death. Autopsy results shows the uterine walls appeared thin while cervix was hemorrhagic. The endometrial surface was entirely hemorrhagic with necrotic tissue and blood clots. The lungs, liver, and spleen are enlarged and kidney appeared pale. Blood taken during autopsy shows a rise in total white cell count and prolonged bleeding profile. Blood and tissue from spleen and liver isolated Group B Streptococcus, and the endometrial clot contained bacterial colonies pointing to an infection. Therefore, the maternal mortality is identified due to invasive Group B Streptococcus.
Based on our research, we had found an article about the study of Group B Streptococcus infection in 50 patients, which does not include infants and women with genital tract and pregnancy-related isolate. Data were examined prospectively and retrospectively from 2003 to 2005 at tertiary level multidisciplinary hospital in Kuala Lumpur, Malaysia. Group B Streptococcus infection may cause infection in neonates, infants, pregnant female, and non-pregnant adults, which is about 65 years old and above. Most adults will have underlying conditions such as diabetes mellitus and diverse spectrum of infections. Based on the diagram, the result revealed only one patient in the range of 0 to 10 years old and the rest were adults. There were 32 males and 17 females of patients respectively. Most patients are in the age of 41 to 60 age group, which have 24 patients, followed by the 61 to 80 age group, which have 40 patients. Now talk about the most common underlying conditions. We can refer to the pie chart below, where diabetes mellitus was the most common underlying condition that can be seen in 35 patients, which is about 71.4%, followed by neurological condition, which is cerebrovascular accidents and paraplegia, that can be seen in 8 patients, which is about 16.3%, and malignancy in 6 patients, which is about 12.2%, and among others. Among the 50 patients, only one patient did not have any identifiable underlying condition.
The sample needed for diagnostic testing of bloodstream infection is whole blood transported in blood culture bottle. This sample is taken by withdrawing blood through venipuncture technique. It should be collected as soon as bloodstream infection is suspected in a patient. Physician must perform hand hygiene prior sampling to avoid contamination, and perfect fit of gloves is very important. There is no requirement of fasting for patient before going for venipuncture. Patients should be informed of the risk of the procedures to avoid them from being panicked. After sampling, the specimen should be transported in the correct container, which is the blood culture bottle. Its function as culture medium for organism to grow if present in the sample.
There are some tests that we can detect the presence of Group B Streptococcus in bloodstream infection. First, we have a blood culture. What is BD BACTEC? BD BACTEC is an automated blood culture system that utilizes fluorescent technology in detecting the growth of organisms in the blood culture bottles. The principle of BD BACTEC is microorganisms in the test spool inoculated into the BD BACTEC vial metabolize nutrients in the culture medium, releasing carbon dioxide into the medium. Carbon dioxide will cause a dye in the sensor at the bottom of the culture bottles to react. This controls how much light is absorbed by a fluorescent material in the sensor. The fluorescent level measured by the instrument's photodetectors corresponds to the amount of carbon dioxide released by the organisms. The BD BACTEC fluorescent instrument determines whether the vial has positive result by analyzing the rate and amount of carbon dioxide increase. There are two tests for biochemical. First is catalase test. Catalase test is used to differentiate gram-positive bacteria species. The test is done by placing a drop of hydrogen peroxide on a glass slide. Using an applicator stick, a small portion of a colony is then added to a drop of hydrogen peroxide. If bubbles are formed, it is interpreted as positive catalase, which means the bacteria has catalase enzyme that breaks hydrogen peroxide into oxygen and water. If no bubbles form, the result is recorded as catalase negative. Vitek 2 compact system. Principle of Vitek 2 compact system. The Vitek 2 compact system uses a fluorogenic methodology for organism identification and a turbidimetric method for susceptibility testing. The test kits available include IDGN, IDGP, ASTGN, and ASTGP. Cassette is placed manually into a vacuum chamber station. After the vacuum is applied and air is reintroduced into the station, the organism suspension is forced through the transfer tube into microchannels that fill all the test wells. Inoculated cards are passed by a mechanism which cuts off the transfer tube and seals the card prior to loading into the carousel incubator. The carousel incubator can accommodate up to 30 or up to 60 cards. Each card is removed from the carousel incubator once every 15 minutes, transported to the optical system for reaction readings, and then returned to the incubator until the next read time. Treatment will be provided for patient that has been diagnosed with Group B Streptococcus infection. The first treatment will be vancomycin for penicillin allergic patient. Surgical care is considered for patient that has underlying disease such pneumonia and endocarditis. However, Group B Streptococcus infection can be prevented by vaccination against the Streptococcus agar-lactate, especially for mothers in their third trimester. This vaccination helps in preventing neonatal and maternal Group B Streptococcus disease.